mynews.studio.
Picture this. In Geneva, a robot is picking fruit in an orchard while drones fly overhead, scanning for endangered species. But the real question is, will these kinds of AI breakthroughs eventually reach the world's most remote clinics?
Today is July 14th, 2025. The AI for Good Global Summit just wrapped up in Geneva. And it wasn't just a showcase of new tech. It was really about using artificial intelligence to address global health and improve equity. Should we start with those diagnostic tools designed for rural clinics?
That's a great place to begin. At the summit, they demonstrated AI systems that can process patient data in real time, even in areas with spotty or no internet. For example, there's a diagnostic platform for rural clinics that analyzes medical images, flags urgent cases, and recommends next steps, all on a solar-powered tablet. The result? Faster treatment, fewer misdiagnoses, and better outcomes, especially where doctors are in short supply.
But do we have any real data yet? Are these tools actually making a difference? Or is it still just theory at this point?
There are some early case studies. One report from the summit described a pilot in rural East Africa. There, AI triage software reduced wait times and improved detection rates for tuberculosis. Another project in South Asia used an AI-powered chatbot to deliver maternal health advice in local languages. It reached thousands of people who previously had no access to this kind of information.
That's significant, but can we talk about risks too? How do they avoid repeating old biases or letting mistakes go unchecked in these AI systems?
That was actually a main focus at the summit. There were panels specifically on building ethical frameworks before rolling out these technologies. Like, for example, mandatory audits to check for bias in training data, and making it clear how algorithms are making decisions. They also talked about having local medical professionals oversee AI diagnoses, so it's not just the machine making the call.
Right, and I noticed the summit also highlighted youth-led projects. Why involve students and robotics teams in all this?
They actually showcased projects from marginalized communities. For instance, a robotics team built an automated drone system for disaster recovery. It mapped flood damage to help first responders decide where to go first. The idea is that innovation isn't just top-down. Young people in those regions are creating solutions for their own communities. It's about building skills and local capacity.
That's a real shift. Still, all these projects depend on infrastructure. How do they plan to get these tools out to places with almost no connectivity?
There were workshops at the summit on something called Early Warning for All, focusing on using AI to identify at-risk groups who aren't yet connected. Plus, there's a push for partnerships, governments, UN agencies, private companies, all working together to improve digital infrastructure. Some startups even demoed AI that works offline or with minimal data, so a constant connection isn't always necessary.
Governance came up a lot in the sessions. Were there any concrete recommendations from the summit on how to manage AI risks worldwide?
Yes, there were high-level dialogues that produced a draft framework for international cooperation. It includes guidelines for ethics, transparency, and accountability, especially when it comes to health and disaster response. The goal is to harmonize standards, so if an AI tool is approved in one region, it's trusted elsewhere too. There's also a push for oversight from multiple stakeholders to prevent misuse and protect vulnerable groups.
So it's not just about the technology itself, but about who benefits and who's protected. Did the summit leave people thinking AI can really close the global health gap, or are there still big obstacles?
The overall mood is cautiously optimistic. AI could help close these gaps, but only if we keep up with access, training, and good governance. The summit made it clear. If we don't address the digital divide and ethical risks, these tools might actually increase disparities instead of narrowing them. So, are we ready to make sure that doesn't happen?
That's really the heart of it. Today's summit showed what AI could do for clinics, disaster management, and youth empowerment. But it also highlighted the need for transparency, oversight, and local voices to guide the process.
And that's where we'll wrap up. We've explored how AI is being put to work for social good, the hurdles it faces, and why inclusive governance isn't just a side note, it's essential.
Thanks for tuning in as we unpack the UN's AI for Good Summit, where technology meets real-world needs and sometimes tough questions.
Thank you for listening. This episode was brought to you by mynews.studio. Try it now for free.